A very good evening to all of you. Today we are going to talk about purple bag syndrome, and it's a clinical condition that you commonly encounter in your clinical practice, especially in patients who are on long-term catheter, either because in the form of an SPC or a perurethral catheter, because of a stricture surgery which is awaited, or because of maybe a spinal cord injury, the patient is on catheter. So whatever be it the cause of the catheterization, these patients can sometimes present for a with a purplish discoloration of the tubing of the urobag, as well as the urobag itself might undergo purplish discoloration. Why does it happen? Now, this is a benign condition. Okay, the main reason why does it happen is because of the metabolites of the tryptophan, which undergoes metabolism or breakdown into certain products. We'll be looking at the metabolic pathway and what are the products which gives rise to this discoloration. But the first thing is it's a benign condition. It's because of the tryptophan metabolism, and it happens in presence of a UTI in alkaline urine. So these are the prerequisites for formation of a purple bag. So number one is a tryptophan metabolism in presence of an alkaline urine and UTI. Okay, and it's not a malignant condition; it's a very benign condition. But it's really bothersome because it might be an indirect indicator of an underlying UTI. Okay, or it might be a presentation of an underlying UTI. Now, what are the risk factors? Who are the patients likely to develop this? So, as I said, prolonged catheterization is one, and associated cause of UTI. So, what could be the cause of UTI? Even in, for example, female patients, they are more prone to develop UTI. Therefore, they are more prone to develop purple bag syndrome. Now, the UTI has to be usually uh, in presence of an alkaline urine. Then only this predisposition to tryptophan metabolism leading to interaction with the tubing of the urobag and the catheter then gives rise to a purplish discoloration. And number three, another very important factor is a chronic constipation. So if the patient has a constipation, then the bacteria in the gut they get a lot of time to undergo to break down the tryptophan into metabolites, and that could be one of the risk factors or predisposing factors for a purple bag syndrome. Number four, in case of CKD, patients who are in CKD, they have decreased excretion of the tryptophan metabolites. So they have tryptophan metabolite collection in their circulation, and they might undergo breakdown by the bacteria again to give rise to this discoloration. Now, let us understand a few things about this mechanism. How does it happen? So, this is very important flowchart. It's taken from one of the latest publications on this. Now, what does it say? The tryptophan, it's undergoes metabolization by the bacteria in the gut to produce indole. Okay, so this indole enters the portal circulation, and then it is going to be going to the liver, and from there it is going to be excreted by the kidneys. Okay, now the product which is metabolized, which goes to the liver and comes out from the liver, is an indoxyl sulfate because sulfation happens in the liver. This is also known as indicans. So sometimes in some of the books you'll find they mention indicans are the main predisposing factor for the discoloration of the for the purple discoloration. So indicans is indeed acted upon by the urinary bacteria to produce indoxyl. Okay, and they will be converted in an alkaline urine into two important products. One is an indirubin, other is a indigo. Okay, as the name suggests, indigo is a blue color. Indirubin is a red color. Rubin stands for is a red color. So the combination of the two gives a purplish discoloration of the urine bag. One striking feature is you don't find this discoloration in a sterile container. For example, the same urine from the same patient, if you take and deposit in the sterile container, in a glass container, you won't find this purple discoloration. This has to undergo some interaction with the tubing material and the urobag material that gives rise to this purple discoloration. So the common organisms which are responsible are Pseudomonas, E. coli, Proteus, Providentia, and Klebsiella. These are the UTI which can lead to alkaline pH. Okay, and yes, so the one I was saying, the coating layer of the urobag and the tubing is responsible for this deposition in the classically in a urobag and not seen in the other sterile containers. Now, so why is it clinically important? So number one, as I said, this is important because it could be a cause of an underlying UTI. It could be a manifestation of an underlying UTI, and you have to treat the management of this purple bag syndrome is number one, change the catheter. Okay. Number two, antibiotics. So this was asked in one of the scenarios in the exam. So it has to be very, very smooth and very simple because it's a very straightforward scenario. So in scenarios like this, which we commonly encounter in our daily practice, we should be very confident and we should make sure there is no gross mistake in this. So how does the patient present? Why does the patient present with the, who are the patients likely to develop purple bag syndrome? Make sure you know the risk factors and know the basic algorithm of this metabolism of tryptophan and the basic management. Don't get scared if they ask you the management of this. Change the catheter and treat with antibiotics of the underlying UTI. Okay. So this is the gross information about the purple bag syndrome. Stay tuned for more videos. Thank you so much.